Thank you, Roxana. Good morning, good rising, everyone. It is a great honor for WHF, but for me personally, to be opening this special 2025 edition of RISE together with ESC and Jean-François, who are our long-standing partners on the road to achieving real equity in our field. We are here today because we want to make sure that 4 billion people, that's about half of us on this planet, have access to the rooms, to the tables, to the buildings, to the hospitals, to the innovation and research centers that they need to enter to be able to improve healthcare, to be able to save lives, and to be able to give hope. When visionaries Roxana Meran and Marie-Claude created RISE 6 years ago at this very Congress where ESC and WCC were together, a little bit further up north in London, the idea was that they opened the door for us, for all of you here, from the inside. It is our responsibility to keep that door open, and I would add, a bit on the rebellious side, as I am, even if we have to break down some walls, we have to do it, digitally, physically, whatever it takes. Because Roxana said at the very beginning, 6 years ago, that stagnation in the field is no longer acceptable. This was valid then, it is more than ever valid today. And the progress that we've seen that you have achieved only for 6 years shows that actually it is possible. And yes, actually it is very, very urgent. At the World Heart Federation, our commitment to equity in cardiology and also ensuring equity in care and treatment of everyone so that women are not underdiagnosed and underrepresented is part of our work across our different programs, across all of our policies and everything we're trying to achieve. It is how we define global impact, because our values and what we're based on and why we exist is to look after everyone in the world, including people in low and middle income countries. We are not there yet. I will speak to you about one particular program that I think is illustrating what we are trying to do. It is a program that started 10 years ago. It's called Emerging Leaders Program, and it was created to give opportunities and network for healthcare leaders and not necessarily only cardiologists, but nurses, advocates, everyone who wants to make a difference in the world of cardiovascular health. When it started, the number of women participating was 21%, so that's 10 years ago. Now we're close to parity, and then there are some cohorts who are actually predominantly women are there predominantly. That's in recent years. I live by the journalistic principle, show, not tell, and let others speak. So I will lend my voice to few of these emerging leaders who had shared with us what this program had done for them. Chiara Di Cesare, now professor and director at Essex University, told me that being part of that program gave her a safe space to share and learn and to grow as a leader. She said, WHF has provided me with the opportunity to share and implement my ideas, to experiment and develop my own personal leadership model, and to be recognized for who I am as a researcher and leader, regardless of my personal characteristic. Dr. Zainab Atia Dakil, the only female interventional cardiologist in Iraq, when she joined our 2021 cohort, has since audited national cardiology practices, earned a degree from Oxford, and is advocating for women's heart clinics across Iraq. Her ambition is generational and is grounded in lived experience of women in fragile health systems. Lilian Bao, from the 2017 cohort, is now executive at Kenya Center for Cardiovascular Prevention and Rehabilitation and leads a multicultural clinical training project. She also serves on our advocacy committee. I will share with you her words. WHF involvement has given me access to global visibility, including invitations to speak, to moderate, or contribute to international forums. Many women lack the opportunities to demonstrate what they're capable of. Since last year, we have also offered a standalone leadership in communications in advocacy program. It's the first time that we only train cardiologists and nurses and advocates on how to communicate, how to advocate, how to influence policies, how to influence change on the ground. And to give you the sense of the impact and the diversity, women who have participated in this program are already driving remarkable initiatives. In Bangladesh, Jubaida Akbar is leading advocacy for a national salt reduction strategy, tackling one of the key risk factors for hypertension and heart disease. In Pakistan, Farzana Amir is investing in children for a healthier tomorrow, creating environments that support healthy eating. Folasade Ali, she launched a campaign, Know Your Numbers, in Nigeria, and it's bringing heart health awareness to rural communities, mobilizing traditional chiefs and community health workers to provide screenings, education, and preventive care. Together, these projects show the power of women leaders. But we want more. I want more. WHF is the only umbrella organization that brings together scientific societies, advocates and researchers, foundations and clinicians, and with a specific focus on LMICs, therefore uniquely positioned to shape the global conversation on women's heart health. On a personal note, I come from one such middle-income country, Bulgaria, where women are twice as likely to die from cardiovascular disease than women in Denmark, also within the EU. I am also a daughter of a breast cancer survivor, and my grandmother died from heart disease at the age of 59. Every day, I see the difference in the reactions to these two stories, albeit one is actually with a happy ending, my mother is alive. But I get a lot of sympathy for cancer, and I get a lot of silence for the victim of heart disease, which is my grandmother. So why I'm here is because I have 3 daughters, and I want them to have equal opportunity, regardless if they choose to enter your field, cardiology, or my field, political science and communications. Whatever they want to do, I want them to be taught, led, treated by people who look like them. And I think this is why we're here today. We're here today because RISE is all about aspiration, and it's all about equity in action. Thank you very much. Enjoy your fantastic day ahead.